Hey everyone, how are you? My name is Alex and welcome back to my channel. So I'm in a really good mood, believe it or not. And I say believe it or not as if you would know what I'm about to talk about. You probably read the title of the video, so you know what's coming to some extent. So yes, I did in fact have open heart surgery. That's my, incision scar there that you could see. I just want to show that because for educational purposes so that people could understand the significance of what has gone on. So I had something called the Ross procedure, and I'm going to talk about the Ross procedure in a minute, what it is, and so on and so forth. I also want to talk about my experience in the hospital because that was an experience, and I also want to talk about my history with my heart murmur and what led up to this. But before I do that, I do want to say I am not a doctor, I am not a surgeon, I'm not a medical professional in any way, shape, or form. This video is me talking about my experience. If you gain something from it, good for you. But it is not a piece of medical advice. This is not me trying to practice medicine or anything like that. Okay, this is purely educational, personal vlog type of video. Okay, good. Glad we're all clear about that. So when I was 14 years old, I was diagnosed with a bicuspid aortic valve. That is very hard to say. It's a very common heart murmur. A lot of people have it. It tends to be more common in women than men from what I've heard. But don't quote me on that because I could very well be wrong. So, and I do apologize, occasionally during this video you will hear me sniffle and cough, and that has a lot to do with the recovery post-surgery, and I'll get into that eventually. So, the thing with the bicuspid aortic valve, and specifically my experience, is everybody's a little bit different. There are some people who have had just exercise intolerance from the moment they were born. I've heard of people who have been perfectly fine for their whole life and not needed surgery. There are people who have been fine with just the aortic valve repair and they've lived a great life up to that point. I've heard of people who have been like me, where I ended up with my aorta significantly enlarged due to the insufficiency of my aortic valve. In other words, my heart had to do extra work. And because my heart had to do extra work, that means that my aorta had to get bigger. And aortic aneurysm is not a good thing because that can eventually rupture. Just like if you blow up a balloon, eventually the balloon is going to pop if you keep blowing air into it. Well, in the case of your aorta, it can, eventually expand to the point where it bursts, it ruptures, and that is life-threatening. We did not want that to happen to me, so the surgeon who I was recommended to, he and I sat down and talked about my options, and we decided on the Ross procedure. And I don't regret it even remotely. I can tell you that right now. Do I like the recovery? No. But do I regret doing this? Absolutely not. Because A, this has saved my life and prolonged my life significantly. And on top of that, I now get to be a pilot because the FAA accepts the Ross procedure. So before, I had to stop my pilot training because of the insufficiency of my aortic valve. Now I don't have to worry about that because that's all been fixed. Now, I'm not good at explaining the Ross procedure at all, like how they actually do it. And I didn't really fully understand it until after the surgery. But even though I now understand it, I think it is so much better that you talk to your surgeon about it than hear it from me, because I don't want to give the wrong information. It's really, really important that you talk to your surgeon and talk to your cardiologist and really make an informed choice about what you want to do for your health. I can't tell you what to do. I can only speak on my experience. That being said, there definitely was a moment after the surgery that I briefly regretted it. And a lot of it had to do with the lack of independence. I'm a fiercely independent person. I don't like to ask for help. It's not out of stubbornness. It's because you always end up owing somebody, or, you ask for help and they help you in a way that really doesn't help you. And if I have to explain to somebody how to help me, that's not really helpful. That's just infuriating. And it just goes on and on and on. It's a vicious cycle. It's a pain in the butt, and I didn't want to go through it, so I really did not enjoy my hospital stay at all. Now, the surgery itself, before I get too deep into the hospital stay, let me talk about the surgery itself. Basically, they wheeled me into the operating room. I was blown away by the majesty of the bypass machine, because that is the coolest thing I think I've ever seen in my life. I mean, I was brought to tears. Don't get me wrong on that. And no, it was not fear of the surgery. I was not afraid of the surgery at all. And a lot of people are going to be like, oh, that's baloney. No, I really was not afraid of the surgery. The thing is, being able to be in the same room as one of the greatest pieces of medical engineering probably ever made was incredible. For me to have the bragging rights to say, hey, I was hooked up to a bypass machine. Do you know a lot of people who get to say that they were hooked up to a bypass machine at 38 years old and came out fine? Because that doesn't, you don't really get to say that very often. On top of that, I did a lot of research about like the procedure and what they do, because I was just deeply curious. And I did truly try to find actual videos of the Ross procedure because I wanted to see it in action. There really aren't very good videos of it, which shocked me a little bit, because I love to watch medical stuff. Like, I'm very deeply curious about, medical science, even though I have no desire whatsoever to go into the medical field. I just have always found that fascinating. And I even wanted photos and videos of my own surgery, and I would have absolutely watched it. And I know a lot of people are going to be like, are you out of your mind? I'm like, that doesn't terrify me. It's my own body. Of course I want to be able to see inside my own body. So, I looked into things like that. Like, they do have to stop your heart when you have the Ross procedure. They do have to stop your heart, because you can't operate on a moving heart. I mean, that's just not safe. Okay, so they do stop your heart with cardioplegia. I know that there are some surgeons out there that operate on a beating heart. That's them. For me, I didn't want that. I wanted a surgeon who was actually going to stop my heart and hook me up to a bypass machine, because that is just so much more logical and safer. If you look into, I definitely recommend looking into how a bypass machine works, because the fail-safes have fail-safes on that machine. That thing is designed to keep you alive, no matter what. It is beautifully designed. I can't stress enough how just incredibly cool it is, because it is very cool. So, that being said, they stop your heart with the cardioplegia. It is what it is. The only thing that I definitely am not a fan of, but it obviously had to happen, was the intubation. The intubation is definitely the stinky part. That's not fun to go through post-surgery. I'm still having problems from it, considering how many sinus issues I've had over the years. I'm not surprised that I have all the problems that I have. I mean, I reached a point where I had, after getting discharged from the hospital, I had to go back to the hospital because I was having almost asthmatic like symptoms. Like, it wasn't asthma, it was just this vicious, nasty cough that just, my bronchioles were so inflamed. And like, I didn't have a doctor that I could go to, and I had to end up getting an inhaler, and I'm off the inhaler now. I still have the cough here and there, but compared to what it was, it's so much better. But still, it's just, the intubation is awful. And so, they wheel me into the OR, stick me on the bed. The guy gives me the oxygen, which it cracks me up that the anesthesiologist still will hand you the mask and say to you, inhale some oxygen. It's not oxygen. Okay, guys, it's not. It's the anesthesia. Like, I knew what he was doing. I wasn't going to call him out on it. I was just like, I know what's going on here, but it was fine. So, yeah, and I was out in like minutes, and I woke up in the ICU. So I am one of those people who has that anesthesia awareness nonsense going on. I have a history of it, of course. Go figure. If anybody's going to have it, it's going to be me. I have no memories, no vivid memories of the surgery. The only thing that I remember from the surgery is comfort. Just being comforted. Like, feeling comfort throughout the entire procedure. That's the only thing that I remember. And I think if you're going to have anesthesia awareness and you're going to have a memory, that's probably the best memory you could ever have. And I'll tell you right now, like, the surgical team, when they wheeled me in, I got so emotional about the bypass machine. And I think they thought that I, was just going through it emotionally. And that wasn't really the case. It was just more like, wow, what a moment. For me, that's the way that it was. But, I'm sure that they probably had a lot of very terrified people in the OR. And, they were holding my hand and they were talking to me. And, they know about my pilot training, so they were very curious about it. When Dr. V walked into the OR, I got really excited. He got really excited, and it was really cute. And then, he had to talk to the whole surgical team about, this is what we're doing, make sure everybody's on the same page. And that was pretty much the gist of it in terms of being in the OR. It's a big operating room. Like, in 2015, I had like a bunch of pilar cysts removed, and I was in an OR back then. It was much smaller. This was a big OR. Like, it was big. The bypass machine took up a significant amount of space along with every other piece of equipment they had in there, but it was a big room. And you're probably going to have a big room. Your operating room's probably going to be quite large. And so, don't be startled by that because, yeah, and it's not a small surgical team. Like, I figured maybe it would be like 2 or 3 people. No, there was like 8 people in the room. Maybe more. I didn't really count, but there's a lot of people in there. So, yeah, overall it was a very comfortable experience. There was nothing about it that was terrifying at all. And I'm very grateful for that, because if it had been a terrible, stressful experience, I don't think it would have been a good procedure for me. Like, I don't think the procedure would have gone well, but the fact that I was treated so well was just wonderful. Now, when I got to the ICU, there were a couple female nurses who were very impatient with me. And when they took the intubation tube out, I was immediately demanding water. I had a horrible dry throat. I didn't even know why I had a dry throat. Like, I could not comprehend that. And I just kept begging for water over and over and over again. Would just guzzle the water and throw it up because of the stupid anesthesia. And probably all the other medications that I was on. And I would demand more water, and then I would throw it up. And these nurses just kept bringing me water, but I also kept complaining about the pain. And at one point, I was given pain meds, like they kind of figured it out briefly, but it was really hard for me to articulate what I needed and how I needed it, but I shouldn't have to do that because I'm not a doctor. I'm the patient. I was like in and out of consciousness constantly for the first couple of days after the surgery. And like I have very little memory of anything. I mean, there was one nurse, she came in and she was very nice and she relayed a message to me from my mom, and that was very sweet, telling me my mom loves me very much. I had been, and if you're a guy watching this, this is not relevant to you, but if you're a woman watching this, this is extremely relevant to you. I had been PMSing significantly before the surgery, and I had been very worried that I was going to get my menstrual cycle, or like that it would start during the surgery or right after. And the nurse was so sweet. She was like, you didn't get your period yet, and it seems like a very small thing, but it's like that was something that was genuinely stressing me out. And I should note, ladies out there, if you have surgery, whatever it might be, small, large, whatever, you're going to get your stupid period right after. When I had my pilar cyst removed, literally 2 days later, I got my stupid period, and it's like I had literally just finished my period 2 weeks prior. And I'm sorry if that's TMI for people, but it's like that's the reality of surgery. I mean, I didn't have any cramps, so yay, but it was just like, and, it's a thing that happens. So, for the first I was in the ICU for 3 days, and for the first couple of days I was perfectly fine in terms of my menstrual cycle, and then on day 3 it started up. Now, there was this one very young woman, I wouldn't say very young, maybe she was a little bit younger than me, probably close to my age, who was really wonderful. Her name was Lauren. She was such a sweetie pie. She was very patient. There were 2 other nurses who came in periodically, female nurses who I don't remember what their names were, but they were very impatient. And then there were these 2 guys. One guy was named Warren, the other guy was named Brandon. Warren was so wonderful because I have such an issue with being dependent on people. I don't like to be dependent on others if I can do it myself, but I literally could not get out of bed after the surgery. I could not walk on my own. Anytime that I needed to get out of bed, he would come right up, Warren, he'd get right there, and he'd say to me, okay, here's what you're going to do. You're going to hold my arm, and we're going to get you as close to the edge of the bed as possible, and you're going to lift yourself with your legs. So what he was doing was he was making sure that I was not going to fall, which was wonderful. But he was also giving me the option to get out of bed on my own. I think he could see that it was just really, like, even though I didn't vocalize it, I think he could see that it was just really important to me to be able to get my own self out of bed, or at least feel like I was playing a part in getting myself out of bed. And the hardest thing was that I had no strength in my legs whatsoever. I did have really significant edema after the surgery, which could have been why. But it was so just, I had no strength at all. Plus, I hadn't eaten anything because of the nausea, so that was playing a part in it. And I could not push myself backward into the bed because you do have to sleep kind of sitting up or, elevated slightly. And so what Warren and this other nurse, I can't remember what his name was, they would, he'd have the other guy come in. They would take the Chuck's pad that was under me, and they'd use it to pull me backward in the bed so that my butt was all the way in that corner of the seat, because there's nothing worse than, like, laying backward like that. with like your butt sticking out. It was horribly uncomfortable. So, and I remember at one point, him saying like, she likes to have her butt all the way back in the seat, like Focus is like, look, this is what she this is what she wants, okay? So there you go. Like, and he had no issue with doing this at all. It was such a simple thing, but it really was just meant the world to me. And yes, I did tell him that too. So, there was that. And then during the day, I had Brandon. And Brandon was just, of course, my stupid period starts. And he was so helpful with, like, because I mean, you should see, I probably packed like 50 tampons into my, like, I packed a suitcase for this hospital stay, and I packed like 50 tampons into my suitcase. And I literally could not get up and go look for it, so he absolutely went and got me everything that I needed. And you have to understand, I had like chest tubes and a pacemaker wire and a catheter tube and like all kinds of stuff, hooked up to me. Plus there was like, in the back of my right hand, I had an IV. In my wrist, I had an IV. In my elbow, I had an IV. So, and not to be TMI, but I use my right hand when I'm putting in a tampon. That's just what I do. And I literally couldn't use my right hand to do much of anything, and to even like lift all the stuff up was too painful for my right hand because I had all that crap hooked up to me. So I had to use my left hand. So I, had asked Brandon if he could help me with holding up all the tubage so that I could do what I needed to. And he literally sat there holding up the chest tubes and the catheter tube and the pacemaker stuff, like everything, out of the way, so that I could sit there on the commode and put in my tampon. And he was completely unbothered by that. And I'm telling you right now, ladies, if you're attracted to men, you need to find yourself a man who is willing to do that for you, because that was phenomenal. That is a very good man right there. And I'm not trying to be like flirty or anything like that. It's like, that is a good man. And men like that are very rare. So that was incredible. Like, that's the way that somebody should be treated. And I did come to learn from my experience throughout my hospital stay that there are a lot of nurses who will absolutely help you with your period, post-surgery, because every woman gets their period after surgery, so they will help you with that. Again, if this is TMI for you guys, sorry, I don't know, maybe skip through it or something, but I feel as women this is important for us to know about. So, moving on from that, there was also this really wonderful healing garden, like Zen garden thing that they had on like a rooftop at the hospital, and Brandon brought me up there at one point and, wheeled me around, and I, took pictures and sent them to my mom. It was absolutely beautiful. I thought it was very thoughtful that he brought me up there for that. And, like when I had Warren in the evening and whatnot, he and I were talking about his cars and, different stuff about each other and just, having a good time. And it was a really, like, the ICU stay started really awful, but it ended on a really good note. And, excuse me. So, like, I mean, the thing with me and the swallow, like, I couldn't swallow any pills because of the stupid intubation, and like, it was extremely difficult for me to swallow anything that wasn't pudding or ice cream. And the ice cream, like, the reason why I was asking for it so much was because it was so helpful to my throat, not because of like being childish or something like that. Like, I couldn't eat anything else. I couldn't eat fruit because it would like burn my lips, and it was horrible. So, like, Warren figured out a way to break up like the Tylenol for me, small enough where I could swallow it without it like gagging me, because I have a vicious gag reflex too. And so like, these guys really went out of their way for me, and they didn't have to do that, but they did. And that was wonderful. One thing that I will say about me too is that, they brought over the cardiac cart at one point to try to get me up and moving, and I could take like a few steps and that was about it. The second time, um, I made it out the door into like the nurse's station, which was maybe 15 feet, if that. Maybe less, 10 to 15 feet, something like that. I didn't go very far. It was too exhausting. Yeah, the next day, they put me on the cardiac cart, and I did like a whole lap around the nurse's station and everything. Like, I was just like, I had zoomies. And it was really funny because it was like, we went from like a few steps to like 30 feet. It was really, I was very impressed with myself. So, the next day after that, I was moved out of the ICU, and I was, put in a regular room. I had the roommate from hell. And that doesn't make recovery good. So it's important to note that I was on Oxycontin and Tylenol during this whole experience, so I was not all there cognitively at all. And it was very hard for me to really advocate for myself because of that. When I got up to my regular room, and, they're setting up my bed and all that kind of stuff, I see that my roommate's got the TV on. It's important to note that it's like 11:45 at that point, or like 11 o'clock or something at that point. It's like, TV does not need to be on that late. And I know that there are people who fall asleep to a television. My mom is one of those people. I can fall asleep with a TV in the background in my own home because that's a relationship that I have with my mother. That does not mean that I can do it in the hospital after I've had open heart surgery. So what ended up happening was I says to the nurse, like, do we have quiet hours or something like that? Because I don't know if I'm going to be able to sleep with the TV on. The nurse's response, the regular, recovery nurse, not the ICU nurse who brought me upstairs, but the regular nurse, she's like, well, people have the right to watch TV. I didn't know what to say to that. If I had not been on any painkillers, I know exactly what I would have said to that. But nope, I had very limited cognitive function, so I just kind of just accepted that reality. So when the nurses switched a little while later, the guy that I got, he was really sweet. I spoke to him about it. I said, is there something that we could do about the TV? Because I can't sleep and I need to sleep. Because at this point in time, it's important to note that I hadn't really had any legitimate sleep since the surgery. Like, not the waking up from anesthesia kind of sleep, like a normal night's sleep was something that I had not had. That's not good for anybody. Like, it's not good for me. It's not good for anybody to lose sleep like that. So, he spoke to my roommate and directed her to the headphones that she could plug in to the little, TV remote thing and, put on. And that way she could have the TV and I could sleep. Very reasonable. This woman gave him an earful about his conversation with me. She was mad at him because he was friendly toward me. He was friendly toward her too, so I don't know what her deal was, but she was complaining to the nurses constantly. And it was just, she could be so mean to these nurses. And it was honestly terrifying. And then, there were moments when I would get up from bed and I'd hear her, saying quietly, is she getting up? Is she getting up? Is she getting up? Oh, why? She would talk to herself. She would have these, midnight phone conversations with people, talking about things that were extremely inappropriate. It was just, she was the roommate from hell. It was horrible. It's like I couldn't get any sleep. I was miserable. It was awful. So, I spoke to the nurses enough times where they said to me, you need to talk to the head nurse. and asked for a room change. And I'm like, oh, I should do that. That would have occurred to me completely on my own if I wasn't on those painkillers, because I was on the painkillers. That just didn't occur to me. So I like talked to everybody. Like, I didn't know who the head nurse was. I just talked to everybody. And eventually word got around. And then, like, the morning after I was advised of that, my surgeon came to visit me in my room, and he said to me, we're working on the room situation. And literally the next day, they moved me to my own room, or to another room where there was this woman who was about to be discharged. And so I ended up with my own room. I don't think that was really their intent, was to give me my own room, but to just get me away from the crazy lady. So that's what they did. And I'm not even going into every little detail about this woman, because I kind of don't want to, because it's really inappropriate. Like, there was some stuff that occurred that I don't think would be appropriate to put in a YouTube video. What I can say is that at one point she did threaten one of the nurses. And so, yeah, like, they were really, really working hard to get her discharged, because they were like, I could tell they were really tired of her, and I don't blame them. I wouldn't want a patient like that either. The majority of the nurses who took care of me while I was in the hospital were wonderful. These were really great people who I got very attached to. And it was really lovely, because I had been terrified that I was going to be treated like garbage by a bunch of nurses, because I've had that happen to me. And it wasn't that way at all. Like, there were definitely a couple of bad apples, like in the ICU, and there was that one who thinks that people have the right to watch TV in the middle of the night, which, no, people have the right to recover. That's what people have the right to. And so there was that. But, you know, even her, like, she wasn't bad. She was just not the best decision making, in my opinion, but not like the worst person ever. You know, it's the kind of stuff where it's like, at this point I can just let it roll off my back. It's not even worth being upset over. But it really wasn't that bad. When it started to get uncomfortable was on my discharge day, because there was one PCA who was trying to, like, run me out of the room. It's like, I haven't even gotten my discharge paperwork yet, and the person who's helping me come home, my mother, isn't even here. Back off. And so, you know, she did kind of quiet herself down. I did talk to my nurse, my RN, about what had occurred, and I, you know, said this girl's name and everything. And all of a sudden, that PCA's attitude, like, completely changed. And it's important to note that I was off the Oxy at this point, so now I was very, like, with it, you know? And it's actually really funny, because Oxy didn't just make me really stupid, it also took away my sense of humor. When I got my sense of humor back, I was just, like, living it up with these nurses. Like, I was having a grand old time. And so it was a lot better when I was off the painkillers versus when I was on them. And so, you know, I did have one item of mine end up go missing, which I was very upset about. That really made me mad for a lot of different reasons. And, like, your stuff should not go missing when you're in the hospital. You shouldn't have to have everything under lock and key and hide everything constantly in your own room when you're at the hospital. Like, that shouldn't happen. And it wasn't even something that was really valuable necessarily. It was just like, that's my stuff. Keep your hands off. You know, nobody should be touching my stuff. And, like, there was one incident where a druggie was in that cardiac wing for some reason. And they got into an argument with the nurses over painkillers, and I got up, wheeled my IV tower thing into the bathroom, and I locked myself in there until I knew he was gone. because, like, normally I would not be that way. Like, normally I would not be fearful like that, but it's like, considering that I've had this sternotomy where they've had to cut through my breastbone, I can't protect myself. I can't. I have no way to protect myself, so it's like the only way that I can protect myself was to hide in the bathroom. Not that, like, he hadn't come into my room or anything like that, but it's like he was literally arguing out in the hall right outside my room. And I was not, no. So, there was that. I don't know how it would be for other people, but I wasn't going to talk about this, but I do think it's important to talk about this too. Before I left the ICU, they did have to take out my catheter. I'm telling you right now, having the catheter come out was probably the most wonderful experience on the planet. Being able to pee on my own again felt so good. It was so nice to just be able to go to the bathroom normally. Because that catheter just... And I felt so bad for Warren. You know, I was so angry about the catheter because it was so uncomfortable and it wasn't draining my urine like it was supposed to. So I was just feeling the constant urge to go to the bathroom, but nothing was coming out. And he spent so much time making sure that that thing was going to work the way it was supposed to. Because after a while, that gets really painful. So there was that. Having the chest tubes taken out, you know, first of all, the PA taking out the stitches, or undoing the stitches around those chest tubes was really painful. The chest tube removal itself, basically she's like, take a deep breath, and I did. Hold it, and I did. She pulled out the tubes and told me to exhale. It was not painful to have the tubes taken out. It definitely felt weird, but it was like super quick. However, the sound just... The sound is very similar to a cat puking. I mean, that's literally, like, after a cat finishes doing that, like, gagging thing that they do, and, like, when the hairball actually comes out, it's literally the same sound. It's disgusting. It's, like, it looks like a murder scene. I mean, it was really nasty. Having the neck tube taken out really wasn't... I just have no memory of that. And I'm kind of glad. Maybe it was really awful and my brain just, like, canceled it out or something, or maybe it really wasn't that bad. But I just have, like, no memory of the neck tube coming out. I'm kind of okay with that. A couple days later, when I was out of the ICU, I had to have the pacemaker wire taken out. That was terrifying and uncomfortable and creepy, and I don't ever want to go through that again. As a matter of fact, I never will go through that again for the rest of my life. I am determined to make this Ross procedure that I had, this whole thing, last for the rest of my life. I am determined not to have a resurgery. I'm not going through that again. Because, oh my God, that was creepy. It's not painful. It's just weird and creepy, and it just does not feel good to have this tiny spiral wire taken out of your chest. It just does not feel good. There's nothing good about it. It's not going to be fun. And so those are like the really big sucky parts of that in terms of having things pulled out of me. After the pacemaker wire was taken out, I had to lay there for 30 minutes. Earlier in the day, I'd been given a diuretic shot. If the PA had looked in the chart, she would have seen that. And I was still on the oxy at that point, so the first thing out of her mouth should have been, let's have you go to the bathroom before we do this. Well, damned if, like, 10 minutes into me having to lay there for that 30 minutes, I got to go to the bathroom. And I'm telling you, my bladder swelled up to the point where I couldn't hold it anymore, and I peed on myself. And looking back on it now, I don't feel embarrassed about it, but at the time I was mortified. And my RN, she felt so horrible for me. And like literally right, because it's like they took the thing out at 9 o'clock in the morning. Right at 9:30, my RN was in there. I mean, she flew into my room. She flew in there and was helping me with washing up and, fixing my bedspread. And she was just incredible. Like, she felt absolutely horrible for me. And I feel horrible for this RN, though, because she had to clean up my pee. The day before, she had to clean up my puke because I threw up on myself because I couldn't take a particular pill she had given me. So it's like, how many more of my body fluids is this woman going to have to clean up? And it's not like I'm forcing people to do that. I really could not do it myself. And I really hated not having the ability to do that myself. And I mean, by the time I was done with my hospital stay, I was going home predominantly independent, not fully independent, but mostly independent. Like, able to get up out of bed, get in and out of bed on my own. I was walking on my own, like literally the day after I got out of the ICU that morning. The PT guy, he did a walk with me, and, he said, I want you to walk on your own. I'm like, okay, cool. And that's what I did. And I would go on these little walks around the wing over and over again. And I had no issue with it at all. And I go on walks now every day. And I'm in a much better place physically than I was when this whole thing started. But good Lord, what an experience. And, I think it's really important for people to understand that your recovery is entirely up to you. Your recovery is going to be your experience. It's not going to be exactly like mine. You might get the nurses from hell. You might get the best nurses ever. You might have zero issues with nurses. You might have a great roommate. You might not. I can't guarantee any of that. What I can say is just that this is what I went through. I hope that, possibly it helps you out in some way or informs you in some way. But bottom line, I just wanted to share my experience. And, there's probably little things that I might remember down the road that I might talk about in other videos that I release. But that's basically how it happened for me. So with that being said, I want to thank you guys very much for watching and understanding what I'm going through right now. It's been an experience, and I'm sorry that there hasn't been any content, but it is what it is. So again, I want to thank you guys very much for watching. I hope that this was potentially educational or informative for you. And I definitely recommend that you talk to your doctors and your surgeons if you have the same, heart defect as me or something different, and, get the right information from them, not necessarily from me. So with that said, thank you guys very much. And as always, I will see you guys next time.